a little bit like you're milking a cow, moving fluids from the occiput down. Right. Then I'm going to go and just do one side of the neck. So here I'm getting into the suboccipital triangle. I want to be on one side of the nuchal ligament, and I want to use this to get into the small intrinsic muscles of the neck. I can follow that until I get onto the trapezius, and then I can grasp all the way out to the edge of the trapezius. I'm going to replace my hand so that his head is supported the whole time. Do the other side. We're going to forearm push the trapezius. The shoulders, because they're suspended by the musculature of the neck, act a little like a seesaw. If I push down on one side, the other side shoulder comes up. So if I'm going to work effectively on this muscle group, I need to stabilize the opposite side. Right? Otherwise, I won't get any effect of what I'm doing. So I'll just place one hand on the opposite shoulder. My rear foot is going to be slightly turned out, and I'm going to step forward with my other foot so that it points in the direction that I'm going. Just like the forearm pushing on the leg, I'm going to use the proximal 1/3 of my arm, where the meaty, fleshy part of my arm is. I'm going to place it down on the shoulder at the trapezius, making sure I have no pressure moving medially towards the neck. I only want my pressure going laterally, right? The neck is not very stable from forces in this direction. I want to take up all the slack in the tissue, so first I let it sink down a little bit, and then I'm going to roll it in place. Right? You can see all of this slack is removed. Then I'm going to use my legs to shift my weight and push my body forward. I can't stress this enough. First, take out the slack. Second, shift the weight to push. Do not try and do it as one motion. It's not effective, right? If I'm busy rotating my arm as I'm sliding, it's not until here that I've actually taken the slack out of the system, and so my technique is only effective for a very short portion of the muscle fiber. I want to take out all my slack first, then shift.
Same thing with the other side.
Slow.
Doesn't have to be slow, doesn't have to be fast. It's usually going to be somewhere in between. I'm going to do round rubbing from the base of the occiput, so right up here, along the top of the trapezius muscle, all the way out to the point of the shoulder. So, because I'm working on the neck again, I have to support the head again. And if you're too close, you're going to bend the elbow, you're going to lift the shoulder, you're going to collapse the armpit space, and you're going to have difficulty lining the thumb up in the direction that you're moving. Right now it's perpendicular because I'm trying to go that way, but it's going that way. If I step back and let my arms open up, the space under my armpit open up, now I can place my thumb in the direction that I'm going. This is a relatively gentle technique. Right? If I try and really dig into the flesh and into the tissue, it's hard to make movement. So I want to stay close to the surface where I'm just sort of gliding along like a sled rolling over the snow, rather than like a shovel trying to dig a hole in something. There's a saying in Chinese medicine, two fingers equal one thumb. So if you find it uncomfortable or difficult with the thumb, you can use the fingers also. That's totally fine. Then we're going to pluck trapezius. So this is an uncomfortable technique most of the time. It strongly moves qi and blood through the muscle. Because it's a strong sensation, we're going to immediately hammer afterwards to disperse that sensation. That makes it tolerable for patients. So just like plucking at the Achilles tendon, I'm making a sort of C shape with my hand, but I'm leaving a space. I'm bringing that around the belly of the muscle, and then I drag it through the muscle belly, leaving the same space. I don't want to compress my hands and my fingers so that that space disappears. So 3 or 4 times, relatively gently, and then hammering. The hammering is like a sandbag fell to the ground, and so the